Chapter 27, FLK FLP. After graduating from nursing school, I went to work at a local hospital in Bradenton, Florida. My first position was in an intensive care unit where I managed 2 patients. One was unforgettable, and the other convinced me this was not the area I wanted to work in. The first was a critically ill woman in room 550. I was charting in the nurse's station when I noticed excitement coming from my patient's room. Before I could rush in, I heard an announcement. Code blue, room 550. Code blue, room 550. Suddenly, there was a flurry of activity as the floor filled with doctors, nurses, and respiratory personnel. Orders were shouted, and the resuscitation team did CPR. Working quickly, they brought her back to life. A tube was inserted through the mouth into the airway and attached to a ventilator, which assisted her breathing. As a recent graduate, I stood on the sidelines. The experience was overwhelming. Once she was stable and could breathe on her own, the tube was removed. I was certain she would be thankful to have survived. Instead, she groaned, "Why did you bring me back? I was happy. Now I'm miserable and in pain." I realized they brought her back just to die again. I missed the opportunity to ask about her spiritual condition or where she had been that made her so happy. The second patient, which had a huge impact on me, was a middle-aged gentleman with a peptic ulcer, an ulcer in his stomach that was bleeding. The doctor ordered me to put a tube down his nose into his stomach. I would put small ice chips in and draw them out until the fluid returned clear. I don't know how long I repeated this, but the painful expression on his face convinced me this was not the area I wanted to work in. I transferred to the newborn nursery as soon as there was an opening. My charge nurse was outspoken and boisterous. I liked her a lot. She rode a motorcycle, and I remember how mad she was when she was required to wear a helmet. Our CNA was an older woman, the wife of Russ's boss, and very knowledgeable and solemn. We worked together quite well. On mornings after a full moon, we usually were extremely busy. The nursery would double in size, and I would scurry about taking babies out to their moms. One morning, the doctor was just leaving a room I was quickly rolling an infant into. Halting my entrance with his hand, he motioned me to back out. I retreated into the hallway but was flustered as I had 20 babies waiting to get fed, and this delay would put me farther behind. "I have lots of crying babies," I insisted. "Is there a problem?" He whispered, "Look at this infant." "She looked fine to me." "This baby is white," the doctor continued. "The mom in this room is not white." I was shocked to learn that 10 years earlier, in 1970, there were no women of color on the 4th floor. The rumor was that women of color were relegated to the basement with their infants. Having never lived in the South, I was appalled at such recent segregation at a medical facility. However, a brave African-American housekeeper told the administration her daughter was going to have her baby on the 4th floor, the same as the white women. Apparently, that's when things began to change in postpartum at our hospital. Still, some pediatric doctors seemed more concerned with their own patients than the health of all babies. One afternoon, I followed a doctor who perused the rows of cribs looking for his infants. As we strolled along, he glanced in each crib, then stopped briefly at one bassinet and calmly announced, "This one's dead," then strolled on. I grabbed the baby just as the charge nurse came running over. She revived the infant, but I will never forget how casually he pronounced the child deceased and proceeded down the aisle. I loved working with the babies and believed they were all beautiful. However, there was one I found to be most disagreeable. Although the infant was healthy, she was just odd-looking, perhaps with an unusually large nose or ears. I don't recall. However, I assumed the mother must have been mortified when she compared her infant to the others in the nursery. I wanted to assure her that as time went on, her baby would grow to be adorable. Laying the infant in her arms, I was prepared to give a short word of encouragement when she exclaimed, "Isn't she the most beautiful baby you've ever seen?" Yes, just lovely," I lied, realizing that beauty really is in the eye of the beholder. When I relayed my experience to the doctor, he laughed. "When you have an FLK, you look for FLPs." I looked at him quizzically, wondering if this was a medical acronym I should have known. I repeated, "FLK FLP?" He chuckled. "If you have a funny-looking kid, you look for funny-looking parents."